So we found that Virat is lactose intolerant. The mindset of Virat, when he found out that he's lactose intolerant, and from that day onward he stopped taking milk. Most of the athletes knows the basics of nutrition and they take care of their diet. It is just some triggers where they don't know how their body is responding and where which part is missing in their diet. So one thing with genetic testing is once in a lifetime test. You don't have to repeat quite often because your DNA doesn't change.
Empowering health through science backed nutrition, transforming lives with evidence based research, and the co founder of Unlock Fit. Our guest today on the Settle or Be Better podcast is Mr. Fahad Shah, who's going to be talking to us about genetic testing and a lot more. So, welcome, Mr. Fahad, and over to you. Why don't you begin by telling us a little bit about your work, your current work in the genetic testing field?
Thanks, Sakshi, for having me on this podcast. And the journey began from 2013 when I started a company called Adams Genetics, which is into genetic testing for personalized nutrition. Okay, so what we do in Adams Genetics is we analyze your genetic makeup and how your body will respond to different kind of let's say food product based on your genetics. So what we do, we take your saliva. From saliva we take out the cell, and in the cell, every cell there is a DNA. So we screen or basically sequence that DNA and try to understand that how your genetic makeup is different, and that that the difference between your genetic makeup will respond to different kind of food products. So take example, you are a, let's say if you found that you are a lactose intolerance, so there is a gene called LCT, and a lot of people have a variation in that, and which makes them lactose intolerant. So usually we drink milk, and there is an enzyme called lactase, which our body release, and then lactose, basically, which is the sugar inside the milk, convert into the simple form of sugar, and our body absorb. But those who have a variation, our body is not producing enough lactase, or completely there is no lactase. So those people respond very badly to milk product. So it's very easy to understand where we have to stop milk, because milk is a complete food. It's a good source of protein, calcium, many minerals and vitamins. Even especially for vegetarian, they get a lot of vitamin B12 from there. So randomly saying that okay, milk is bad for you is a very bad idea. Yeah. So if you know that you are a lactose intolerance, it make a lot of sense to basically stop a milk. So with that in mind, we have started this company called Adams Genetics in 2013, and we worked with all the elite players in India, be it Indian cricket team from Virat to Hardik Pandya, the women Indian cricket team we have worked. From that, we went to many of IPL teams like KKR, RCB, Delhi Capital. Then we worked with a lot of Olympians where we tried this genetic testing and helped them achieve the best performance in terms of their game. And that's what we did. So when this COVID struck, so earlier we were in more or less one-to-one consultation where we were meeting. And when the COVID struck, it was a call, and that's where we decided to go digital. So at one go you can reach to a lot of people, and you don't have to go there. And that's the way the whole world is moving towards digitization of everything. And that's where in 2020 we have started another company called Unlock.fit. So it's an app which is based on let's say it's available on Android as well as iOS. And with this app, you download, you buy up basically our different plans where will give you a testing, a DNA testing, blood testing, a doctor consultation, and a personalized nutrition experts are there who will give you a consultation and design a personalized nutrition plan based on your need. So that's what we do at unlock.fit.
Amazing. That's really great to know. And it's amazing to see how we have moved on from just consulting a nutrition who would give you the same old nutrition plan to now, getting more in touch with the genetic testing, and then that, determining what is the way that we should be eating. And you said that you work with a lot of athletes, right? So when it comes to peak performance and the changes that you made in their diet and the nutrition after the genetic testing, how much time did it take to sort of for them to experience changes in their game, in their performance, and what impact did it have? Like, was it a major impact? Were there major changes? If you could give us some examples.
Okay, so some changes are quick and some are quite basically takes time. So for any diet you start, if you basically put all these things in your day-to-day life, it takes 3 to 6 months or a year to get the real sense of in terms of improvement in the performance. But some things are very quick. Take example, if someone is lactose intolerant or a gluten intolerant, or let's say some one are very bad metabolizer of certain vitamins, or absorption of certain vitamins are very poor for some. And if you just correct, you may get a result within a week. Okay, but for those where we are seeing that okay, we have to change the whole diet plan based on genetic makeup, then usually it takes 3 to 6 months where we see the best result in terms of which basically convert into the high performance. uh, so take example, Virat is one where we have started working with him in around 2017 when he was in the basically transformation zone. And one thing which so there are many things we find out, and like this is one thing which is quite basically public, where he shared this because of confidentiality we cannot share all the information. So we found that Virat is lactose intolerant. Okay. And being a Punjabi, being a North Indian, milk is quite a staple for us. And and that's a beauty of Virat, and that's you can say like the mindset of Virat when he found out that he's lactose intolerant, and from that day onward he stopped taking milk. That switch, that's a one trigger which helped him a lot. And there are many triggers which were there, and we worked on that, and world knows where Virat is. So I'm not saying that this is the only thing which change everything, but it plays a very important role in his overall performance. So that's how it impacts the whole performance of any elite athletes or even anyone in a general life.
True.
Yes.
Absolutely, that makes so much sense in terms of, I'm sure that this might not be very accessible to just every other person, or they might feel like it's not very affordable at some point. But I feel like athletes or even people who have been working out for years or who have been, very conscious about their nutrition for years and they've hit the plateau, they don't know where to go from there. I think that that would be a great time to then get the genetic testing done and see that what is it that they're missing, because gone are the days when we just talk about okay, we need to have protein, we need to build muscle, and that's it that you have to do for your health. Because with
Yeah.
this information there's so much more we can tap into, and every athlete or any other person who has hit that plateau and they want to sort of break out of it and they want to tap into that better performance, this would definitely come in handy that time. So that makes so much
Yeah.
sense.
Yes. And I think you said exactly the same point which I want to derive from here. Most of the athletes knows the basics of nutrition and they take care of their diet. It is just some triggers where they don't know how their body is responding and where which part is missing in their diet. And
True.
this test helps in terms of identifying those missing links. So their life is very simple after this testing, that they know the trigger points, then they know the missing elements in their diet where they are lacking. Because everyone respond very differently in terms of their vitamin and mineral absorption or basically metabolism. So maybe my requirement for iron, so as per the RDA is, let's say your requirement is around 20 milligrams, but it may be very different because of my genetic makeup.
Right.
So if you know this, you can actually personalize your nutrition intake.
Absolutely. And now that we know where it helps us in peak performance, and for people who are probably in an already healthy state of body and mind, they know where to go from and accelerate from here, right? It would help us in that. But does it also help us in chronic illnesses, or conditions like cancer and diabetes? Because this is something that at least I haven't. I mean, I think it might be out there, but I haven't come across where a cancer patient is told to get their genetic testing done, or a diabetes patient is asked to do that, because it's just the regular same thing that a doctor says, okay, I have to go for a walk, I have to stop sugar. That's all that we come across very often. Like, even when my parents go to their diabetes doctor, it's the very same old, very traditional thing that get talked about. But how does it help us in chronic illnesses, and can it actually make the difference that probably people are missing out on?
Obviously. So it's a very good point how it can help in the strictly chronic diseases, like say diabetes or heart disease, or even let's say cancer. Take example of carbohydrate. So majority of the cases, those who are suffering from type 2 diabetes, this happen because they have excess amount of blood sugar level in their bloodstream, and their body is unable to basically utilize those glucose molecules. It may happen because they have high carbohydrate sensitivity. So we check a gene called PPAR gamma in our test, and there are more gene also, which actually tells us how our body actually metabolize carbohydrate. And if you know that, okay, you are sensitive, or your sensitivity towards carbohydrate is very high, you can actually limit your carbohydrate intake. So this is a small trigger. And even if you are a healthy person, you are not diabetic. And if you know this information, you know that my risk of having diabetes or high blood sugar is very high. So I should take control to basically prevent myself from these chronic diseases. Because once you are in that zone, you become a diabetic person, then it's really difficult to basically change or cure. So it helps in terms of identifying the trigger point of, let's say, diabetes. Take example of heart disease. We are checking many markers which are related to your cholesterol metabolism. It will tell you those people who have a very high risk of high cholesterol level. So if you know these things quite early, then you can actually take all the preventive measure to change it. Even it will tell you the what kind of food choices you will make. Even it tells that, okay, your saturated fat sensitivity is very high. So let's say if you have a very high fat saturated fat sensitivity, then you can limit your saturated fat in your basically diet to, let's say, 6% of total calories which you are consuming in a day. If you have a normal basically saturated fat sensitivity, you can go up to 10 to 12% of total amount of saturated fat in your diet. So if you know these things, then I think it make a lot of sense to basically apply all these preventive strategies in your diet plan, and you're changing the whole lifestyle. Take example of cancer. We do basically a profile which is known as detoxification profile. So whatever we are eating, our liver is efficient to detoxify those not good element for our body, like some toxic metals, some of the things which, because of cooking method, if you are deep frying, there are many poly aromatic compounds are formed in our food, and actually our liver detoxify itself. We don't need anything. But some people, because of their different genetic makeup, they are not as efficient as someone else who have a normal genetic makeup. And if you know these things early, you can actually decide that, okay, I have to limit deep fried or charged meat, and I will add more basically cruciferous vegetables or certain vitamins or certain supplements to improve my detoxification profile. So, like, these are small, small points will make a lot of difference in your health.
Absolutely, that makes a lot of sense. And my next question is, like, is this a myth or is it a reality when people say that, diabetes runs in my family, so I'm very prone to have it, I'm sure, in my 30s, or, like my mom, my grandmom, they all were really much on the healthier side when they were in their 30s. Am I going to be like that as well? People say that a lot, but is it really truth or is it a myth? And can genetic testing help us predict the kind of diseases we might be prone to have? We don't even probably have any symptoms right now that we, are very visible, but can it help us predict it and then sort of work towards it? And another add-on to this is, can we stop the cycle? Like, for example, if diabetes has been running in my family and tomorrow I want to have a baby, but can I do something that would actually stop that, which would, for my baby's future, would not be passed on?
Yes. So it's a very, very good question, Sakshi. So there are two factors to it. So there are two types of genetic diseases. One are monogenic diseases. Take example of a breast cancer, hereditary breast cancer. And if someone have a mutation in their gene called BRCA1 and BRCA2, which you have heard in the case of Angelina Jolie, she was carrying that particular mutation in like in her DNA, and because of that she went through this mastectomy or breast removal. So there are certain diseases where even if mutation is there, the probability is very high, let's say 70 to 90% of chances that you may develop at certain age a particular disease, in that case a breast cancer. There are other diseases which are polygenic in nature, where just one basically risk in one gene will not make you a diabetic, or will not make you even a cancer, or will not make you a heart disease patient. There are many factors are attached to it. Genetic is a very, very crucial factor in it. Then let's say if you see that it is 50% of the whole problem, and 50% is your lifestyle, and that's a good thing, and that's why genetic testing become very important. So let's say, take example, my family history is very high in terms of diabetes. My mom is diabetic, my father is diabetic, and because of that family history, I have a very high risk of let's say diabetes. Okay, what happened, I was quite active. Okay, and because of that, let's say I'm 40 and still I'm free from diabetes. I'm taking care of my let's say health, food, and everything. My one of my elder brother, who was he was very let's say living a very bad lifestyle. He was not taking care of his food, and whatever comes to him, he eats. And at the age of 25, he developed diabetes. Okay, so it's a strong correlation of family history. Now comes to a genetic testing. If, let's say, now I know that my what is my genetic predisposition, that I have tested myself and found that my risk for diabetes is very high. Now it makes further basically endorse the point of family history, that now you have a very strong family history, and now you have seen in your genetic report that my risk for diabetes is also high. Now it makes a lot of sense to change my lifestyle and food habit. Otherwise my risk will become very high, and I'll become a diabetic person if I'm not controlling it. So if you have a data in front of you, then I think it basically make a very it makes a very rational decision for someone to take a change, because everybody says that you have to live a good lifestyle, you have to eat good food, but nobody cares. The moment you see your basically blood report, that okay, you have a high blood sugar level or high cholesterol, then suddenly you start doing everything. But with genetic testing, even something is not there in your blood test, but it says that, okay, you have a high risk of certain problems, then you can make all the preventive measure, even something happened, even before something happened to you.
Absolutely. And this does seem quite easy to work with, say, in metabolic disorders, because, like you said, that, it's as much a lifestyle as much as it might be a genetic, right? So that makes sense, because a lot of it can be fixed through lifestyle, which people are just sort of lazy to take that first step and be consistent with it, right? But what about when it comes to cancer? Like, recently I spoke to a friend who has a strong family history of cancer and brain tumor on the maternal side, right? And they always talk about these stories about their relatives having to visit the hospital, and constantly living year in and out with cancer and treating it, and going through this cycle. So how do we sort of work with that when it comes to specifically, say, cancer or such scary diseases of all time? Because that's the biggest scare when we think about, I want to be healthy, because diabetes also, like you said, has a major impact with what a lifestyle is, so we can control it. But sometimes you'd see the healthiest people, like growing up, you'll see these people who are like the most conscious about their health. They are working out, they're telling you what to do, they're telling the family what to do, and they are the ones who are getting cancer, and they probably didn't
Yes.
even see it coming. So how can we sort of work with cancer specifically, and what role does genetic testing play in that?
So I think in cancer, uh, especially hereditary cancer, is totally genetics. Okay, if you're carrying certain mutation in your, let's say, you or your family history of basically cancer, which make a lot of sense to go through genetic profiling. And if you know that if you are carrying certain mutation, then you can consult with oncologist and discuss these basically report with them and take a preventive measure, because there are many things which can be done early on to prevent these disease to happen. So that's a one thing. So there are different kind of cancers. Some in or in every cancer there is a big component of genetics.
Right.
So one is a hereditary cancer, one where genetics is involved and your lifestyle. So let's say if you are not sleeping on time, okay, if you are drinking a lot of alcohol, you are smoking, okay, so then there are also chances to develop a cancer. Then, with the help of genetic testing, a doctor can decide which medicine will work better on you based on your cancer tissue profile. So that is called a personalized medicine. So based on your genetic makeup, they can decide which chemo will work on you. So they don't have to try different chemotherapies on you. They know that, okay, this is your mutation, and this medicine are there is a medicine which is directly kill that particular mutation or that the growth of the cell, and they will use it. So that's how it is so personalized that you don't have to do hit and error,
Right.
and you know that how it works.
And another question in this is that, are oncologists already using genetic testing in treating their patients, or is it something that we would have to proactively do it for ourselves?
Yeah, so I think now, because let's say when I have started this company called Adams Genetics in 2013, there was a awareness issue. People were not aware about these testing. Even doctors were not aware that these kind of testings are available. Even they have read something in the literature, but in a practical scenario, these things were not available. Even in some cases, it was available. The cost was very high. Now after let's say after 10 years, there are a lot of change has happened. Now new breed of doctors are quite aware about these testings, and even the cost effectiveness of these basically genetic tests help them use in many of their cases. So now these testings are available at a very affordable cost, and even most of the doctors, especially the oncologists, are using these tests.
Right. Of
Yeah.
course. That makes a
So
lot of
even
sense.
let's say you can even ask. Sometimes they may have an inhibition that if I recommend this test, because which is even costlier compared to the blood test. So you can actually ask them that, okay, these kind of testings are available. would you recommend these tests for preventive measures? So they may basically guide you.
Right. Understood. And the same question that I had for, like metabolic disorders, when it comes to cancer and genetic testing, can we break the cycle? Like, if I have that in my gene and, like I said, if I want to procreate, can I do something that I would not pass it on to my child? Or can I do something when I'm choosing a partner? And, does genetic testing come and play in that, we would sort of overpower each other's
Yeah.
diseases or something that we would pass on to the child? Can we do something that would stop this cycle and at least to some percentage reduce the risk of passing it on to the child's future?
Yeah, so that's a future of which we call designer baby. Okay, it is not just basically you can prevent many diseases, and that's a future. We don't know that how it will come out, but the basically the hope is, let's say, the way, let's say, before you are getting married and you do your genetic testing and check that, because there are certain basically genetic diseases happen to your let's say baby, because of like both of you, like husband and wife are carrier for certain basically diseases which are
Right.
genetic diseases. So it make a lot of sense to do genetic testing before marriage, to understand that, okay, uh, that like the probability of having those kind of genetic disorder in my baby. Even though, let's say, because marriage is not it's not like a it's not in a, it doesn't happen in a robotic fashion. It's because there is emotion involved and there are so many things are involved, and we are human, by the way. So we take most of our decision emotionally. But even after that, if you do this genetic testing and you know your profile and your husband's profile, then I think when you are planning a baby and when you conceive, then you can go. There are genetic testing available. Once you conceive between, let's say, once you are conceived within 3 to 4 weeks, there is a test called prenatal testing.
Right.
uh, yeah, so there even they can understand if that baby is carrying those mutation or not, and based on that you can take some preventive measure. If that baby is carrying certain mutation and the chances of genetic disorder is very high in that baby, then you can take a call that you want to carry or you want to take a heart disease.
Absolutely. I'm sure that this specific segment would definitely interest a lot of our youngsters listening to this and, at least be encouraged to get their genetic testing done as soon as possible, because it's quite interesting to know that what your genetic makeup is and how can you sort of bring about some changes, some little changes that you might be missing out, over the years, that would
Yeah.
make the difference, that, you've hit the plateau and it would really help you progress. So that makes a lot of sense. Thank you for sharing that with us. And lastly, are there any health transformation stories that you can share with us that were really surprising, with just a few changes after genetic testing made the major difference for them in their health? And it can be in terms of illnesses or in terms of just achieving better performance and peak health.
Okay. So basically, we or basically I work a lot of with cricketers. Okay, and where we have seen a tremendous change in terms of their performance. And for an athlete, performance is important, but let's say they come across many injuries, and if someone can help them recover from that injuries faster, or even they can minimize their injury risk, they are very happy and they love that person. And recently, I worked with two Ranji players, and uh, last season, the whole last season, they were out of the game because of injuries, and their physio basically recommended me to meet and do something for them, and they are very good players. Both are ballers. And what we did, we analyzed their genetic makeup. We found that, okay, their risk, because in our genetic testing there is a portion where we are there is a section where we are checking your how do you respond to different kind of exercise, what is your power profile or endurance profile, your recovery speed, your injury risk, your ligament tear risk, and so on. So a lot of information we have, and we have their nutrigenetic profile also, where we know that what kind of uh, vitamins they are like more prone to have a low level. So we have all that data, and we personalize their plan. And now this year, like they are playing for the whole year without any injury. They played in UP IPL, they performed really well, and they are in basically in their respective Ranji teams, and without any injury, they are doing really well. So even my physio said that I recommended to you, and after that recommendation, they are not coming back to me. So it's a loss. So, but he was happy that they are not getting injured. Like these kind of stories where certain triggers, because someone they were have there was a lactose intolerance. They have more prone for injuries, so they need certain supplements like collagen, zinc, vitamin B12, because they were vegetarian also. So now you know that what are the things you have to include in their diet, and which make a lot of sense to them also, because compliance is something which is very very important. And if you counsel with the data, then it make a lot of sense to athlete to comply. Otherwise everybody is saying the same thing and they won't comply.
Absolutely, and recovery is one of the major factors that athletes specifically are thinking about, and at times they are doing something or the other that is hampering their recovery in some way. And I feel like this is a great way for them to identify that. And
Yeah.
also, I mean, we also recorded an episode about regenerative medicine and how it helps in the sports industry, but that is also something which is absolutely expensive, and not every athlete can really afford it. And even its availability in India, and to check the authenticity, it's quite difficult. But with genetic testing, now that it's coming up, I feel like over the last decade, it has really grown, and we can really identify how to work with it. And for athletes specifically, that's a great news, because I feel like that's a lot more affordable than the much bigger, much more technical approaches that we might want to go for. So I feel like it's a lot more affordable also now getting into it. So that's great news for athletes.
Yeah, Sakshi, so I want to mention, because this affordability. So one thing with genetic testing is once in a lifetime test. You don't have to repeat quite often, because your DNA doesn't change whatever you have got from your parents. Okay. So
True.
if you are comparing with your blood test, it's quite cheap in a way, because if you do your blood test today, and if you repeat after, let's say, a week or maybe 15 days, there may change. This may change, but it won't change. Another thing, we at Unlock Fit are working on very affordable this nutrigenetic test or sports genetic test.
Mhm.
So our aim is to bring down. So right now the cost of genetic testing is 25,000 rupees. Okay. Now our aim is to bring down this cost to around 5 to 6,000 rupees. Yeah, and it's not that in, let's say, after 5 years, very soon, within, let's say, 3 4 months, we are in process to bring down this cost to this level. So
Wow.
wish us luck, that we should be in a position to do that.
Absolutely. All the good luck for that. And we can't really wait to witness it and also, make use of it very soon. So thank you for sharing that with us. And one more question, when you talked about supplements, is that, very often we get told that we should get a blood test done before choosing the supplements that we want, right? But what is a better option to go for? Is it blood test or is it genetic testing to sort of understand what supplements would really help you accelerate your health?
Yeah. So the way we work, so let's say if anybody comes to us, what we do, first we do blood testing, we do genetic testing, and then we do the health assessment, their lifestyle, and whatever they do in their day. So blood testing tells us the current situation of that athlete. Okay, it may say that, okay, you have a vitamin B12 deficiency, zinc deficiency, or vitamin D deficiency. Now this genetic testing, it's not telling you that your current situation. What it tells you, how do you metabolize it? So if you have a low level, it is because of metabolism. You're
Right.
poor metabolizer of certain vitamins. So now you know that if I am eating less of that particular food, which contain, let's say, B12, okay, so I have to increase that food in my diet. Okay, and this will remain with me for lifetime.
Right.
So I'll tell you, there is a uh, very interesting story of my co-founder Masood. Okay, so whenever he goes for a basically iron test, he gets a low level of iron. And when we did this testing, we found he's a poor absorber of iron. Now we know that why there was a low level of this iron, because whenever he goes for that test, iron is low. He goes to a doctor and he recommend certain medicines. And after, let's say, he can basically take that medicine for 1 month or two, and then he stops. And again, 6 months there is a problem, tiredness, fogginess, you know, and low energy level. Then again he go for a test, and then again there is a low level. Now he knows why this was happening. Now he has to have this iron level at optimum level. So one is medicine. Now he has to change all the utensils at home. So now his wife is cooking all the meal in iron pan or cast iron pan, which basically gives more iron. And he used just a lemon on it for a better absorption. So that's a one change he did. And now he's aware that, so he made a lot of good choices. All basically iron rich food are in his diet regularly. So that's how you can make all the changes.
Right. And I'm sure that a lot of audience would resonate with this when they have their, annual or a monthly visit to the doctor. They would often find themselves in this cycle of, being deficient in one particular thing. And even after having the medication, and then if they stopped at some point, they would always be in this continuous cycle and not
Yes.
change the root cause, right? So
Yeah.
that makes so much sense. Thank you for sharing that with us. And this brings us to the end of the podcast episode today. Are there any last messages or thoughts that you'd like to leave us with?
So the future is personalized nutrition. Okay. uh, why it is important to all of us? Because when you have a data, you have a data of genetic testing, you have a data of your blood chemistry, and then a discussion with the nutritionist, then it make a lot of sense that you are not trying so many things which may work or may not work. Now you know that you have a data, and you are taking a very rational decision to improve your health outcomes. So go for personalized nutrition. Is the best investment on your health. And it's not very expensive, because we spend a lot of money on eating outside or buying a lot of uh, tech, basically gadgets. But this is one investment which will pay you for lifetime.
Absolutely. And I mean, it's gone are the days when, just like stocks, we ask our relatives or our friends what to eat and how to exercise. I mean, it's our genes that are now telling us how to do it, right? So that's just amazing to optimize it for us. So thank you so much for sharing that with us. And I hope that our listeners can reach out to you and probably, through the app Unlock Fit, and get this done for themselves. And we can't wait for the news that you would be sharing with us about your new tests and the new available things for our new available resources for our audience. So thank you so much for that. The details are in the description below, so anybody can reach out to you or Unlock Fit and get to know more about genetic testing for themselves.
Thank you so much, Sakshi.
Thank you so much. That's it for today's episode. I am Sakshi Pawar, and I'll be your host for the Settle or Be Better podcast. So stay tuned. I will bring more inspiring stories away. You know the drill. Subscribe to the Settle or Be Better podcast. Like, share, and comment on our videos. And hit the bell icon, because you don't want to miss the mind-boggling health discussions we're about to bring for you. Why settle when you can be better?